The latest virus surge across the United States has produced a worrisome rise in hospitalizations among children, especially the ones who are too young to be vaccinated. Parents across the country are facing a heightened anxiety over the risks of Omicron on children. Several states have reported an increase of about 50% in pediatric hospitalizations in December. New York City has experienced the most dramatic rise in the last week. Doctors and researchers are now seeing evidence of Omicron affecting children.
We're seeing many more children infected at this point and being admitted to hospitals. We're seeing record numbers of admissions of all children of all ages, from newborns all the way through 21 years of age in hospitals and in ICUs with Omicron. Not to say that it's more severe, but it's my experience so far is that it's not less severe, at least in kids.
As per preliminary data, there are two basic reasons behind the rise in paediatric admissions. One, a large number of children are becoming infected with both Delta and Omicron variants. And second, the reason is that low vaccination rates among children over the age of 5. Younger children under 5 do not yet qualify for a vaccination, and only those aged 16 and older qualify for booster shots in the United States. Children overall are somewhat less protected from the virus than adults. Last week, nearly 200,000 childhood cases were reported nationally, and an average of 1,200 children were hospitalized with the coronavirus each day. Roughly 1 in 10 American children has tested positive for the virus since the beginning of the pandemic.
Yes, the under 5-year-old group is definitely the most vulnerable group, and we're seeing a lot of children being admitted to children's hospitals, both here in New York as well as other states. And we as a society owe it to them to protect them by being vaccinated and undergo broad testing.
It remains unclear to what degree the Omicron variant is responsible for rising hospitalizations. And despite optimism that the Omicron variant will be even less dangerous to children than its predecessors, experts have acknowledged that it's still too early to know for sure. Despite all the fears, data and anxiety, New York is pushing for its schools to reopen in full capacity. New York City will stop quarantining classrooms and will instead prioritise a ramped-up testing programme in schools.
Schools need to be open. And so we are moving every day to make sure our schools remain safe. We have been working very closely with the mayor-elect and his team to make sure everything is in place for January 3rd.
Instead of holding online classes for unvaccinated students, they'll be given free rapid at-home test kits, and all the asymptomatic students who test negative can return to schools. These steps have raised some concerns among parents. Some say that schools should be kept remote for at least a week after the holidays and travel exposure. Others have called for mandatory testing for all children, as well as school employees.
So from our standpoint, what the state of New York can do to help best is to make sure that there are sufficient testing kits available to be used by the school district. And that is why I've directed our Department of Homeland Security and Emergency Services to provide 2 million tests to New York City to allow children to stay in school.
Well, to get more on this, our correspondent Susan Tarani is joining us live from New York City. Susan, what's the latest from the ground on this surge in the Omicron cases across the United States?
Well, Nick, as you mentioned, we now know that Omicron is the dominant variant here in the United States. Over 58% experts and scientists say of individuals have the Omicron variant, and scientists say cautiously, optimistically, that perhaps that is good news considering the fact that it seems to be milder and less transmissible. However, many individuals continue to suffer from the more deadlier Delta variant. The nation reached its 7-day highest average of over 254,000 new cases on Tuesday. Hospitalization and deaths are not as high as they were during their peak last winter and last March. They are higher. They haven't caught up to these high numbers. However, we'll have to wait and see how those numbers will fare in the coming weeks and whether or not Omicron will continue to be the dominant variant or not. Here in the East Coast, Washington, D.C., Virginia, and Maryland seem to be the hot spots for the Omicron variant. New York is also seeing the rising cases, also a lot of challenges with testing. Long lines continue. Testing seems to continue to be a challenge, despite the fact that President Biden has vowed to get those tests in the hands of Americans. That's going to be sometime in January. The CDC, the Center for Disease Control, announced that it wants a quarantine time for individuals that are asymptomatic and infected to go from 10 days to 5 days. That has been met with some optimism and some backlash from officials. And President Biden also has said that he does not want to take the path to lockdowns, instead continuing to urge Americans to be vaccinated, boosted, and also get tested. Again, you know, the testing being the main challenge here, at least in New York and on the East Coast.
So, Susan, a huge rise in cases, but schools are scheduled to reopen on the 3rd of January in less than a week. How anxious are parents, would you say?
Well, you know, like everything else, really, parents fall into two groups and polarized on this issue. But I think for the majority of parents, they're going along with what experts and scientists and doctors are telling them. And at least here in New York, we heard that the health commissioners say that about 98% of close contacts do not end up developing COVID-19, and that ventilation and testing in vaccinations make schools safer than anywhere else. At least that's what they're saying now. That wasn't the case last year when the lockdowns were happening and parents were sort of scrambling to find out what to do with childcare when they were working at the same time. So, you know, relying on testing right now, and the parents, at least that I've talked to, being a parent myself, say that, you know, they're going to sort of deal with the fact that, A, you know, if they're over 5, get their children vaccinated, and B, understand that perhaps COVID is something that we have to deal with and move forward with. But, you know, New York is really setting a lofty goal on the other hand, really calling for testing and wanting to bring these tests to students' homes and classrooms, considering the fact that even factories are really struggling to get these tests in the hands of Americans, and the Biden administration is struggling to get these tests really out there from one state to the other, admitting that the federal government really can't do everything in its hand regarding testing. So we'll have to see how that works out, and how, you know, right now January 3rd is the day to go back to school, but we'll have to see, you know, down the line in the winter how realistic that'll be, considering the fact that, again, you know, not to go in circles, but so much reliance is being put on testing, and so little resources is out there for individuals to get tested.
Thank you, Susan. Susan Tarani joining us live from New York City.